We're talking first is the epidemiology, so that is the person, place, and time of how this virus has affected our populations here in BC. And this first slide gives an update on the geographic distribution of COVID-19. This is by health service delivery area of our case of residence. And as you can see, in the past 14 days, we have had cases in all areas of the province. The focus, however, continues to be on the outbreak in the Lower Mainland, with the Fraser Health and Vancouver Coastal Health regions and the HSDAs in those regions having the majority of the cases. Our weekly profile, in the past week we had 667 new cases identified, and as we have seen throughout this, about half of them have been female. Our hospitalizations, we had 52 new people admitted to hospital, and bringing our percent of cases who require hospitalization 8%. That is significantly down from earlier on in this in the pandemic, when as many as 20% of cases were hospitalized, and again reflects the fact that we're doing much broader testing in our community now. And in addition, we've seen a change in the demographic in people who've been affected, with much more younger people being affected, and the median age of people in hospital has also come down. Our deaths continue to be overly represented in people who are older, with the median age being 85. This is the epidemic curve, and that is the curve by when the laboratory test is done, so what we call reported date. And as we can see, there's a bit of a periodicity to that, where lab tests tend to be clustered on certain times of the day. But as you can see as well, we've had an increase in numbers of people who've tested positive since July. And the next slide is the epidemic curve by date of onset of illness for most people. And this gives us a better idea of when people have been exposed and where they've been exposed, and helps us look at where these exposure events have been happening. So the majority of cases, as we can see from this, are related to local acquisition. So still over 80% of cases every day, when we do the contact tracing, we do the trace back to find out where they've been exposed. It is mostly people who have a known contact who's positive or were part of a cluster in BC. And we still continue to get international travel, so cases in people who have returned from India. Most recently, we've seen a number of cases, and we still have temporary farm workers who are coming in and occasionally end up developing disease while they're in quarantine. The next slide tells us about the number of cases in hospital, and as you can see, we've gone up since our nadir in August, but we've leveled off, and we have a consistent lower number of people in hospital now than we did earlier on in our first wave. The same can be said about the number of people who are in critical care in British Columbia, where the number is smaller and it's leveled off. We continue to see people requiring that level of care on an ongoing basis. I wanted to talk a little bit again about the age groups of people who have been affected in British Columbia, primarily in the last month, as we've seen things like schools restart and people going back into work. So we continue to see that the majority of cases, or the age group that's overrepresented now, is the 20 to 29 and 30 to 39 age group. So that's the yellow bars compared to the blue bars. Where we also see is that the population under age 10 is about 10% of the population, and only represent less than 5% of our cases. And the population 10 to 19, again, is underrepresented, even though we're doing increased testing in that age group in the past month. So this slide puts it in a little bit more detail around hospitalizations and critical care and people who've died from COVID-19. And what we can see is that very few young people under the age of 19 require hospitalization. We've had no young people who've required ICU care, and thankfully we've had nobody die in that age group. Hospitalizations are less than 1%. Now I want to provide a little bit more information about what we've been seeing in the back to school update and how we've been monitoring young people and all of the people who are gone back to school. As we know, about 500,000 students, educators, staff are back in our schools across the province since early September. And we also know that some students, educators, and staff have tested positive for COVID-19. But, like earlier in our pandemic, children under the age of 18 or 19 still make up less than 10% of our total cases in the province. So what we're not seeing is schools amplifying transmission in the community. Our testing rates, however, have gone up, particularly for young students. So they're 4 times higher for children aged 5 to 12 and 2 times higher for our teenagers who are in the school age. 2/3 of the tests now are the spit and gargle test, which makes it quite a bit easier for young people rather than having a nasopharyngeal test. And really, our rates remain low in this age group, with only 7 in 1,000 tests being positive for COVID. And as we know, many children are requiring a test because they have symptoms, and this tells us that there are other things causing those symptoms that are circulating in our communities right now, including some of the cold viruses and regular things that we see this time of year that can cause coughs and colds and runny noses and fevers in children. And some of these can be transmitted much more easily than COVID. We have had, as we know, a number of exposures in school settings, and there have been, up until October 1st, there were 50 that were reported, and those are all on the BC CDC and the local health authority websites. As you can see, they're half and half between elementary schools and secondary schools, and majority are in the largest school districts, so in the Fraser Health Region and Coastal Health. And there has been an update. We've had another 14 exposure events that have been reported since the October 1st, and including the first one on Vancouver Island this weekend. If we look at our cases in school-aged children, by the week of report, we have seen an increase, but it has leveled off, and it's not been a large increase at this time. Most of the school exposures are also related to exposure events that happened outside of the school setting. And we know that from especially early on, where people were unrecognized and then spent some time in the schools. And so we'll be monitoring very carefully now that we've moved into past that first incubation period, and we'll continue to work with schools to identify any exposures. What we can see, though, is that the proportion of COVID-19 cases by week in school-aged children remains low, and less than 10%, and that has been consistent in the 3 to 4 weeks since schools have opened. This is our summary of laboratory testing, and as you can see, our testing rates have gone up quite a bit, 15% from last week. With over 50,000 500,000 specimens now tested. So this means that's all of the tests that have been done. 10,000 total positive specimens. Some of those would be more that one person may be tested more than once, and we know that it's about 9,000 and some actual individual people, but our positivity rate remains low and less than 2%, at around 1.6%. And just for this past weekend, our number of tests were 33,409 tests, so over 10,000 tests a day over the weekend, and with 351 positive tests, for a test positivity rate of 1.04%. One of the things that has been a challenge as we've increased our tests is the turnaround times in the lab, and it has increased slightly to around 26 hours or 28 hours on average. Just to give a little more detail around the testing by age, this graph shows us the positive rates and testing by age groups. And as we can see, the 0 to 4, 5 to 12, we've dramatically increased the amount of testing that's done in that age group, but the percent positive, or the test positive rate, remains very low in that group. And that tells us that most people do not have an exposure that has been related to COVID, which is good news. Where we see the percent positive rates being high and staying high are in our older age groups. And again, those reflect the fact that many of these people are part of an outbreak investigation and are tested because they are in a long-term care home or hospital. So the next part we'll talk about is some of the update on our modeling that we've presented before. And first is what we call the reproductive number, so the RT. And on average, this shows us that we have slowly come down in the number of infectious contacts that each case generates. And what we've come down slightly below 1, and we're hovering just under 1, which is where we want to be. That means that we are having connections in our communities. We are opening schools, people are going back to work, but we're having safe connections. And so on average, fewer infections for each case in recent weeks. And each case is now transmitting on average to fewer than one person. What we do know about this virus, though, is that it for most people, they will pass it on to one or less people. But sometimes for reasons we don't know, we get people who shed a lot of virus, and they have potential to spread it to large numbers of people. And what we saw tipping the balance a few weeks ago was when we took measures to try and reduce those environments where people can inadvertently spread it to large numbers. So closing of the banquet halls, closing of nightclubs, closing of those environments where we were seeing transmission events happening, sometimes in large numbers to people. So it's made a difference. The other thing that has made an important difference is people in British Columbia doing what we've asked them to do. And this next slide shows this. This is the dynamic compartmental modeling around trends that we've seen before. And we were seeing, the last time we presented, that our curve was going up again. And what this tells us is that that increase has slowed and is now turned and is coming down again. So our growth rate is decreasing, which means that we are having safe connections in our communities now, that people are doing the right thing, that we have our COVID safety plans in place in schools, in workplaces, in restaurants, and that they're making a difference. So our number of contacts that we're having where we can potentially transmit the virus has decreased. This is incredibly important, and it's a testament to the work that everybody has been doing in BC. It also reflects the fact that public health has been working very carefully with every single case to identify the exposure events, to make sure that people who have been exposed, who might develop illness, are isolated safely and supported. So when they do develop symptoms, if and when they do develop symptoms, they're able to be cared for properly and not pass it on to the next person. So we know that we are at a place where we're somewhere around 45% of the contacts we're having have the potential to transmit this virus. That's where we need to stay. This is what will keep us on this low and slow curve through the next few months, particularly as we go into respiratory season. We still have large numbers of people who are identified as testing has been ramped up and as we're doing the contact tracing. But we all need to continue to do our part to keep our groups small, to make sure we're wearing masks, that we're keeping our safe distance, and we're staying away from others if we're sick. And these graphs present some of the scenarios that are possible should we let our guard down again and start to see increased risk of transmission in our communities. Oops. Finally, I want to present again some representations of our curve and where we've been compared to other jurisdictions. And this first one looks at our case rates and the pattern that we're seeing in BC compared to some other provinces. And as we can see, we're sort of grumbling along. We had been increasing and we're now leveling off. Right now, Quebec is at a rapidly increasing rates. We're seeing Alberta being very similar to us at a slightly higher rate. Unfortunately, Ontario, Manitoba, and Quebec are starting to see rates that are going up dramatically, and we've seen that reflected in the measures that have been taken in those provinces. The next slides are a series that shows our newly case rates and our daily death rates compared to other jurisdictions. And as we can see, we're keeping our curve flat and low compared to many other places. But we are not out of the woods. We need to ensure that we keep it this way as we move into the respiratory season in the coming weeks. And finally, this is the same data reflected compared to other provinces in Canada. We had been moving up, and we've now cautiously started to turn that corner. We've started to flatten our curve. We've started to do the things that we know will help us get through these next few months together, and that was to keep our curve, to bend our curve back down. So there are a few takeaways, as I've mentioned, from this modeling. We are flattening our curve, and it's the work of all of us and the actions that we're taking as individuals and as communities that is making this difference. And it's important for our health of our communities that we continue to do this so that our businesses can stay open, our restaurants can stay open, our schools, all important schools for children can stay open. And it's through our contact tracing we've seen that the majority of new cases are still connected, that we're not seeing a lot of uncontrolled transmission. As many of us are thinking ahead, particularly to this next weekend, to Thanksgiving celebrations, new guidance for safer celebrations is now available on the BC CDC website, and it talks about Thanksgiving. It also talks about some other upcoming activities, including Halloween, and there's some guidance on Halloween, on how we can have other important ceremonies like Remembrance Day safely as well. This year, I encourage everybody, make our celebration large in thanks, large in gratitude, but small in size. As we saw this summer, traveling to other communities can sometimes mean we bring this virus with us. So instead, while many of us would often travel to friends and family, whoever our family is, to spend time together, this weekend, stay close to home. Have a small gathering instead, and reach out and include those friends and family in a way that is safe, and that means virtually for many people. Limit your time together inside prior to or following your meal. Seat guests as far apart as you can. Opt for individual servings instead of a buffet, reducing the chances of mixing. And don't share food and drinks. And always, always remember, if you're feeling at all ill, show you care by staying home and away from others. This has been a difficult few months for all of us. And each day and each month that everyone has chosen to do the right thing, we're helping to protect our communities, to keep our communities healthy, to keep our workplaces open, to keep our schools open, to keep supporting each other so that our surgeries can happen, that we can protect seniors and elders in our communities and in our long-term care. Our actions today have a direct impact on how our province will fare next week and the week after. What we do for Thanksgiving will make the difference for the fall, for Halloween, and for the next important celebration after that. This weekend, give thanks to your neighbors, your friends, and family for doing their part to keep us all safe. We are stronger together by staying apart. And let's continue to find new ways to support each other and show we care at a safe distance. And let's, of course, continue, as we have been doing, to be kind with each other, to be calm, and to be safe.